to make presentation.
Thank you very much, Gongal, and good morning, everybody. Good morning from all around the world. It's an impressive collection of people who are passionate about maintaining momentum. I'm a little bit uncomfortable with my title, Leading from the Front. It's actually you in the countries actually leading from the front, and we are just there to support you in making progress and perhaps building certain areas of capacity, but it's you who actually are the owners of making progress. So I'm Bernadette Abela Ridder. I know some of you. I lead the zoonosis portfolio in the Neglected Tropical Diseases Department. And it's a pleasure, and thanks for having me on this SAARC Rabies webinar on updates on progress. It's a very unusual time. Oh, how do I go forward? I'm sorry. Okay. Sorry, this is... So COVID will have changed our lives. A lot of you from the Ministries of Health are probably repurposed from your rabies programs or other programs to other things. But we must not lie idle. We must keep rabies on the agenda because there will still be casualties, and we need to go on. NTDs in the World Health Organization is a collection of 20 diseases, as you may know. I won't go into detail, but in the last year, we have been working with a lot of consultation with the regions and the countries to update our new roadmap to 2030. And as we were putting this out and hoping that it would go as a resolution through the World Health Assembly, COVID hit. In the meantime, many of the population-based interventions are now on hold as a general recommendation from WHO to governments to restrict social contact, but rabies remains one of the diseases where we encourage countries to maintain a minimum of activities in order to keep away human deaths. So I just want to point you to this new roadmap in which rabies is included. It is a roadmap that is looking towards integrating the multiple diseases that we work on that are mostly affecting disadvantaged populations, but looking at how do we integrate with other diseases within the entity portfolio, but looking at also mainstreaming them into national health systems so that they have a better chance of being maintained over time. And of course, as we are doing today, coordinating among the stakeholders, because one sector cannot get everything done. And all this to strengthen health systems. We see now through COVID, it's a test to health systems. At the moment, we're concentrating on the human health system. And it's very clear where the systems are working and where they're not working as strongly, where there is more discipline within those systems. But we will need to look at the systems beyond just the health and look at our food systems, our market systems, and the One Health, the origin of this virus. So just to put you the entity roadmap into context, it fits within the Sustainable Development Goals. It fits into WHO's program of work, which looks to 1 billion people, more people having access to universal health coverage, 1 billion more people protected from health emergencies, and 1 billion more people having a better life and well-being. And so, again, COVID is a test to the world to see whether our systems are robust enough and we are making progress. So the targets within this new entity roadmap also include rabies targets for elimination, where we have 0 rabies deaths by 2030, which is a huge challenge, but we are slowly making progress. And as I said, this roadmap will be taken forward as a WHO resolution and probably might go through as a silent procedure even at the current World Health Assembly, which is currently taking place yesterday and today. So the main areas that were indicated in this roadmap for rabies is looking at improving planning and forecasting for the program so that we have sufficient rabies vaccines and immunoglobulins, both for human and the dog vaccines for the dogs. Building national capacity in health workers and the veterinary sector, and also strengthening and institutionalizing surveillance, and of course reporting. So we know, you all know, many of you come from rabies endemic countries. We know what works. We know that elimination will save lives. We know that investment in elimination averts treatment costs. And over time, it's actually cost effective for the health systems. And elimination strengthens those health systems and surveillance systems. We also know the tools and the knowledge, and we heard many presentations yesterday which highlighted the tools that are so efficient and can be used and make a huge impact once they are used efficiently. It's around the awareness, education, and advocacy, and dog bite prevention. The second pillar is around dog vaccination and population management. And of course, human bite case management. But we know as well that we need the political will and the insertion of rabies in national health plans, with our health veterinary plans or human plans to ensure its financing and programmatic implementation. And that is still a little bit patchy, but it's great news to hear from countries like Bangladesh yesterday, where rabies is included in the national health plans. So you're all familiar, I would imagine, with the Global Rabies Strategic Plan, which has three main objectives: to efficiently use our tools, our vaccines, the medicines, the technologies, to generate, innovate, and measure impact. For this, we need data, strong surveillance. And the third objective is to sustain commitment. And Ryan outlined yesterday, a phased approach about going about rabies programming, and that it's can't scale up from one day to the next, but it actually takes time. And many of you in the endemic countries are on different stages of that continuum. But it will take long-term investment, and it will take time to reach zero rabies deaths and to scale up dog vaccination. And this has been a challenge, but one of the very good outcomes of last year is that the Gavi, the Global Alliance for Vaccine Initiative, has approved the insertion of rabies in their next strategy. COVID will definitely slow things down and may have an effect on how many countries can apply for rabies vaccines, but many of you on this call come from countries that are eligible to apply for human rabies vaccine. And what is nice about this is that Gavi is looking to WHO to support them in identifying One Health criteria for the countries that will access this vaccine. So together we're looking at ways to encourage countries who apply for human rabies vaccine to also be slowly building their dog rabies control programs. So there are, as I said, there are three objectives in the plan. I will concentrate on the three. I'll give some examples and just tell you about progress from the global side that we're trying to take in order to improve the situation. So for the objective one, You've heard a lot from my colleagues around yesterday. I will just bring up the theme of this year's World Rabies Day. I think it's always lovely to come together around one day, a week, or a month sometimes. In the Philippines, I think there's a month that they celebrate rabies to highlight the needs, to highlight the progress, to show innovation. And we look to asking you, and please feel free to let me know of your interest. I've put my email and the email of our information officer. We look for stories in order to keep rabies on the international health agenda. And so if you have some good stories that we can highlight on WHO's website, please do get in touch, and we will work with you to make that happen. Objective 2 of the global strategy looks at guidance, looks at providing standards and standard operating procedures to support countries on best practices. And I've just put up 2 examples here. Really, the Blue Book, this WHO expert consultation on rabies, has everything you need to know about rabies in a sense, from the virus, the disease, the human aspects, the surveillance, the dog vaccination programming. There are even protocols in the back. So I encourage you to use these documentation that are online on our website. The one thing that kept coming up yesterday was about oral rabies vaccine, which remains a tool that would, if used in countries, should remain a supplementary tool. It's not a panacea, but it would help to increase vaccination coverage in some areas. I think much progress has been made, and definitely from our side in WHO, we have engaged with our WHO collaborating centers to start collating the data. So as you countries, we heard from Thailand, we heard from Goa, India yesterday about oral rabies vaccine. As you move forward, I encourage you to collate the data so we have a better understanding around safety, efficacy, palatability, uptake in societies, the risks and the challenges, so that we can come forward with an update. There is a WHO guide for oral rabies vaccination, but this needs updating, and we're hoping that we can do this as a tripartite. So your feedback will be very, very important in this effort. I want to go into just once again talking about the data and the importance of data to also inform our policymakers and to advocate for diseases like rabies. Without surveillance, there is no program. We really need to put an effort on building surveillance, and the two guidances I showed you just on the slide before provides information around how to implement surveillance in a more efficient way, how to be innovative perhaps. I know in India and in Bangladesh and in Pakistan, there have been very strong programs for, polio, for example. Are there opportunities for using those systems to insert programs for collecting data, like for rabies? But I just wanted to show you this, and many of you might have already seen it. It comes from the article that was published by Katie Hampson, and it's a modeling work done in collaboration with WHO. And it basically shows you that the red line, if we don't do anything, we just keep doing a patchy job on rabies, that's status quo. The red line, the rabies deaths will keep going up, and there's no improvement. In fact, there's more burden on the population. If we improve PEP excess, that's the green line, we will reduce the rabies deaths, and that is a very important aspect. As soon as you improve PEP, then the deaths will go down, but it will never reach zero. We really need to be looking at scaling up the dog vaccination. And it is for the benefit of the veterinary services, but mostly of public health, that we will reduce deaths to zero, and we will reduce costs, not only to the health sector, but also to private out-of-pocket expenses. So if you look at the blue line, on the death side, the number of deaths reduces significantly over a very, very short period as soon as you put in dog vaccination. And the number of people vaccinated needing vaccination will also decrease. So this is a call to you as endemic countries to be really negotiating a sort of a One Health approach to rabies within your systems. It's not easy, we know that, but it is a proof of, we have the proof of concept, we know what works. We need to start embedding this into our national plans. And I think one of the weakest points that we have is the linking of the human health and the animal health surveillance systems. There, in many countries, we have not yet made the link sufficiently enough to make that surveillance powerful, to take out, for example, the dogs that are rabid from communities so that they do not continue biting. If we had an alert system from the hospital to the village, as is done in some places, then we would also reduce human death. So there's a lot that still needs to be done. We're still learning how to do joint surveillance, but I think even with COVID, that gives us an opportunity to start to look at these joint and linked surveillance systems in order to not wait for a human case before we do something. So one other area I would like to bring up is the importance of surveillance that also flows into a surveillance reporting process within a national system, so that the national governments are also aware of the burden on the people, the burden on the economy, the burden on the health systems, and the needs for example, vaccination of dogs and vaccination of people. So we need to have these national surveillance systems more robust, and also the reporting to WHO and OIE in order to exhibit to the world what the situation is and what the trends are in combating this disease. So one of the areas, objective 3, was to sustain commitment and resources. And we are aware, as all of you are, that sometimes it is the scarcity of funding and financing that does not allow scale up, especially of the dog side. So as the Gavi investment starts to take place, we are hoping that there will be a pillar that will support the animal pillar, so we'd have the human pillar through Gavi and other initiatives to bring rabies post-exposure prophylaxis to the populations, and then to have a very strong pillar on the dog side. So we're looking at, in this era of COVID, the importance of One Health and using rabies as the example of reaching a much higher impact, and looking at trying to improve the support to WHO, to the member states, and to also partners in order to scale up the dog vaccination campaign side. So we have an urgency around One Health, and it could actually be of benefit. We know that we have a lack of funding. We'd like to amplify Gavi's contribution by scaling up the dog side and have a sort of exit strategy for the human PEP. And also to look at opportunities to improve data. Without surveillance, we don't have a program. And so we need to be looking at how to bolster this work and how to build local capacity, use the local capacity and innovation so that we can streamline our operations and again, bolster the systems in place and bring them to implement a scaled up operation. So we're looking at finding the supporters in a very similar way like the Gavi financing, potentially using the same financing system for countries to be able to apply for support. This is all in its infancy. We are just starting this work and we are trying to see any interest in the community. Again, COVID has come into the way a little bit, but we will maintain our communications with different organizations and member states to see the appetite to use a financing facility like Gavi to support countries on the dog front. And I would be very interested if you have any opinions around this. Is this something useful? Would a financing facility for countries to access support for their dog rabies programs be useful? Is this what's missing? Will it generate more political support if there was financing to back the programs? I would be very interested. We, as a tripartite and the wider community, would be interested to know whether this could be a catalyst to your programs. So do let us know. You have my email address. Quickly, to just finish off, again, data shows us that as soon as you put in dog vaccination, the human deaths come down. We can reach zero. We'll need a different strategy once we break transmission in animals and then work in a more outbreak response mode of action. But I think one of the very encouraging facts to assist countries to move forward is the newly published procedure by OIE for the endorsement of official rabies control programs. And this might actually be taken up in Gavi as one of the criteria that countries can apply for a PEP vaccine. So it's a program where countries will provide a dossier on the status of rabies vaccine, and the OIE could endorse that program and see some of the gaps and needs. WHO has a process of validation. Again, it is inside that blue book I showed you. Mexico is the first country that has gone through this process of showing that they have truly reached, with evidence and data, to prove it, the reaching zero and beyond zero rabies. That's even breaking transmission in dogs, really. So Mexico was the first one at the end of last year. And as we move forward, OIE freedom of dog-mediated rabies, that's a self-reporting of OIE. We will work with OIE to work on this process as jointly as we move towards zero rabies deaths. I've put the two links in here so that you can find these documents easily, because they're not so easy to find yet. Okay, and I think one last message I'd like to bring out to this forum. You know, rabies is a disease that sometimes doesn't get the political attention. But we have an opportunity here. We know in COVID that the source of this terrible pandemic actually has been through animals and the food markets. And I think what we need to show the world is that using rabies as a platform, which is cost effective, we can use these platforms to, the platforms that we create for rabies, the interaction with the communities, the trust that we build, can be used for other diseases, not only animal diseases when we work in communities, but also human. And sometimes we actually do both at the same time. We do deworming of children and vaccinate the dog. So you can actually do human and animal interventions, especially if you're going into these very rural settings, which are difficult to get to. You know, rabies can be a single disease, but it strengthens the larger system. It also improves that intersectoral collaboration. It brings the different sectors together to build that response capacity and integrated surveillance. And as I said before, you know, regular engagement with the communities builds trust. Dog rabies is a very visible disease, and dog rabies vaccination has a very rapid and tangible impact that's visible to the community. So that helps to build trust. So beyond just the rabies program, I think rabies is an ideal sort of case where we can build that One Health approach, whereupon other diseases, other health concerns can be put. And so with that, ladies and gentlemen, thank you for your attention, and I'm happy to take any questions. And if need be, also you can contact me via mail after this call. Thank you.
Thank you, Bernadette, for nice presentation. There are queries also, but I just want to highlight few things for our participants. If we want funding, then we must have One Health mechanism in place as criteria for funding opportunities. We understand that our countries, they are doing good practice. They are coming up with innovative ideas that needs to be documented, and WHO is happy to document. So she has given those contact details. And she also highlighted importance of data. For that, we need to improve surveillance, not only in human health, but also in animal health. Because animal health sector, they think that it is only human health problem. But large number of food animal, they are a victim of rabies, and it has huge economic impact. Unless we have surveillance system in place, unless we generate data and information, we cannot improve, we cannot contribute to policy decision. And there was also suggestion about school education. It should be mandatory through legal provision, because 40% of the human rabies patients, they are children. And there was also question about PEP in animals. WHO and OIE did not recommend PEP in animals. So we should spend our vaccine for mass dog vaccination so that we can prevent rabies in human as well as animals. And there should be paradigm shifts. So we should not store rabies vaccine for PEP in food animal, but that should be used to vaccinate dogs so that we can save everyone. And rabies is also ideal candidate or model for Operation One Health. And we have to understand that rabies happen not only in human, not only in food animal, but also wildlife. So in that sense, it is the best candidate, and we have to see how we can use this opportunity. To Bernadette, one question, just I want to ask, what is your, yes, it is not easy to achieve 0 human death by 2030. That is the global target. How do you foresee what will be the scenario in Asian countries?
The target is a challenge. We know that it has always been. We acknowledge the fact that it will be in Asia. The countries have for now been focusing on post-exposure prophylaxis, but there's a lot of opportunity where we can drop rabies deaths significantly should we be able to scale up our dog rabies vaccination programs. So I don't have the golden bullet to saying how we are going to achieve this. It is you as countries that have to keep rabies on the agenda to assure that they are in your national programs, and we can support you with parts of your program. So as I mentioned, many of your countries online now will be able to apply for rabies vaccine via Gavi. That's only for the post-exposure prophylaxis. But we are trying, as I mentioned, to build a financing facility that will also support the animal side of interventions. Gongal, help me. You are knowing Asia better. I think Asia has done already quite a good job, but we look to the veterinary sector to bolster their services contribution to rabies, dog rabies vaccination programs and awareness raising within the communities. I think there are great examples in Asia that have worked. When I look at Bhutan, when I look at some areas in India that have made a lot of progress, Tamil Nadu, Goa, look at Sri Lanka, there are good examples. We know it can work. We just need you to keep the flame alight and keep up showing your data to your to the policymakers so that they include it in the programming. Look at Bangladesh, including it in their national health systems budget. This is so important that it is not an external program, but it is embedded within your systems. You can get support and catalytic support from external groups, but it should be owned by the country. And that's the only way you will make progress. Thank you.
Yeah, thank you very much. There is also, we request participants to use chat box. And there is also a suggestion from our participants that we have to use One Health platform to exchange information between human health and animal health sector. And One Health, one of the challenges that in crisis, One Health work well, but during peacetime, we just relax. So that is the problem. So that's why we have to use this One Health platform to exchange information, try to work out how we can plan together. Like we are spending so much money in PEP in humans, but we are spending less money in mass dog vaccination. So human health and animal health sector, they have to discuss together and how human health sector can help animal health sector to get more funding, because this is insurance for human being, not to have rabies. So it will be cost effective and it will be sustainable. So now we are going to second presentation.
Goga, just one last, I forgot to mention Thailand's progress on this as well, have made a lot of progress as well. So you have loads of examples where it is possible to bring on also high level support, be it within the government or outside, to actually keep the voice out there to build rabies programs, but also One Health programs. Thank you. And thanks a lot to everybody for your attention.
Thank you very much. We have to also understand that India is a big population, big country with 1 billion, more than 1 billion population, but success story has been generated within India. Like she has mentioned, Rajasthan, Nilgiris, Goa, Sikkim. So it is the example that it is doable in India. So India does not need to see other countries. So we have to replicate those kind of success story in India, in other countries also, in Karachi and in Cox's Bazar, in Thailand, we have seen. So that we need to replicate. In the interest of time, I would like to request Dr. Tenzin to make presentation on experience from Africa, including how cross-border issues are being tackled. Dr. Tenzin, he's originally from Bhutan, and he has worked in the Department of Livestock under the Royal Government of Bhutan. He has a special interest in rabies elimination program and One Health. Currently, he is working at the OIE sub-regional representation for Southern Africa, Botswana, as a rabies project coordinator, coordinating rabies elimination project in Namibia. He has also provided technical support to member states in the Southern Africa region. And he also worked for FAO, Bangladesh, and he has extensive experience in the field of rabies. And now I would like to request Dr. Tenzin to make his presentation.
Good afternoon and good morning to all the SAARC Rabies webinar participants. I would like to thank the organizer for giving me this opportunity to share some of the rabies elimination experience from Africa. This is my presentation outline and I will touch on three key things: delivery of rabies vaccine from OIE Vaccine Bank, rabies elimination project experience from Namibia, and some of the regional and cross-border collaborations. Africa is a large continent and has 54 countries, divided into 5 regions: North, West, East, South, and Central Africa, and has a population of around 1.3 billion. Rabies is endemic in Africa and only few island countries are free from dog-mediated rabies. But several rabies elimination programs and initiatives are taken in several African countries. Tripartite partners like WHO, OIE, FAO, Global Alliance for Rabies Control, and several other national and international organizations are coordinating the elimination program. But there is stiff competition for scarce resources like in our SAARC region. There are 4 OIE regional and sub-regional representations in Africa, based in Bamako, Tunis, Nairobi, and Gaborone. The OIE representations provide technical support for the country's rabies control program, and one such program is facilitating in the delivery of rabies vaccine from OIE Vaccine Bank. Since the establishment of OIE Rabies Vaccine Bank in 2012 under various donor support, around 22 million doses of rabies vaccines have been delivered to 33 countries in Asia and Africa. In Africa, around 25 countries have benefited from this OIE Rabies Vaccine Bank. These donations played a catalyst to initiate and implement mass dog vaccination program by the member countries. One of the criteria to get this donation is that the countries have a concrete action plan and the vaccination campaign will be conducted using the government resources and logistics. In Africa, particularly in the southern region, we have formally handed over the OIE donated rabies vaccine to the agriculture ministers through a simple handing over ceremony. This has increased the visibility of the OIE Rabies Vaccine Bank and donor support, and also sensitized the highest policymaker and other stakeholders on the importance of dog vaccination and rabies prevention program. Once the vaccine is delivered to the member countries, the utilization of the vaccine is followed up so that the vaccine do not lie somewhere and get it expired. A final progress report of the campaign is also submitted by the beneficiaries. This map shows the vaccination campaign conducted in Zimbabwe last year, where they have targeted 3 rabies hotspot areas. Within 2 weeks campaign period, they have vaccinated 58,000 dogs with around 82% coverage. The principal difference between Africa and Asia is the ownership of the dog. In Africa in general, more than 90% of the dogs are reported to be owned but free roaming within the communities in the rural areas. But these dogs are available for vaccination, and the dog's owners would bring dogs to the vaccination point. And that is why the vaccination campaign is feasible and successful in Africa. The main challenge in Asia or in the South region is due to large number of stray dogs. Now I would like to share rabies elimination experiences in Namibia. Namibia is a large country that shares around 1,400 kilometer border with Angola in the north and thousands of kilometers with Botswana, Zambia, and South Africa. Namibia is ethnically very diverse. This is the rabies surveillance map in Namibia, and both dog and wildlife mediated rabies is prevalent. Namibia has good rabies surveillance system. In Namibia, farmers cut the head of rabies suspected animals, both domestic and wild animals, and then submit head to the veterinary centers. The whole head is then transported to the veterinary laboratories for confirmation. This may be one difference between Namibia and in our SAARC region, where in our region only the livestock officials or the lab technician would visit the site and collect samples. This map shows the dog and human rabies in Namibia. The dog-mediated rabies is reported only from the 8 northern communal areas where it shares border with southern part of Angola, and the rabies incidence is correlated with human densities. To control dog-mediated rabies, Namibia developed a national rabies control strategy in March 2015 as a One Health plan and was endorsed by the government. To implement the action plan, Germany funded the project with technical support of OIE and FLI. First, the mass dog vaccination was piloted in the red shaded region in May 2016. All the relevant stakeholders, communities were involved as a One Health approach to take ownership of the project. Since Namibia was organizing mass dog vaccination campaign for the first time, the vaccination teams were trained to ensure successful conduct of the campaign. Rabies education to the school children and public were conducted before the start of the vaccination program. The education campaign was conducted by a separate team of rabies educators and have covered a large number of schools and public. Radio programs were broadcasted throughout the campaign to create awareness on rabies and vaccination program. The timing of the vaccination campaign is very important. The vaccination was conducted during the school holidays, and the school children played an important role in the vaccination campaign in Africa. During the pilot phase, some 40,000 dogs were vaccinated in two split campaigns with up to 96% coverage. The pilot campaign was a huge success. Based on the success of the pilot project in one region, the vaccination campaign was then rolled out to the entire 8 regions of the northern communal area. Besides targeted vaccination campaign that was organized during school holidays, rabies vaccination in dogs was also conducted along with annual FMD and CVV vaccination program in cattle at a cattle crush pen. Crush pen is a fixed structure within the community, and there are hundreds of crush pen in Namibia where farmers bring their animals for vaccination. They also brought dogs for rabies vaccination that has increased the vaccination coverage. There was a huge success both during the pilot and in the rollout phase of the campaign, where thousands of dogs were vaccinated covering large area in Namibia. Although some challenges such as lack of manpower and transports were encountered during the campaign. The impact of the dog vaccination program is visible. The positivity of rabies in animals has reduced, and the spatial distribution of disease has also reduced. The human deaths due to rabies has reduced from 23 cases in 2015 to only 1 case in 2018. It has also strengthened the One Health collaboration and the veterinary service capacity to organize the campaign. In addition to the proof of concept demonstrated in Tanzania, KwaZulu-Natal in South Africa, and in Philippines in Asia, Namibia has again demonstrated that rabies elimination is feasible with dog vaccination. These are some of the key take-home messages that would ensure successful implementation of the rabies control initiatives. These 2 papers describe about the implementation experiences and challenges of fighting rabies in Namibia. Both the papers are available online. I will now share how Namibia and Angola are collaborating cross-border rabies control. The people living along the border between Namibia and Angola are related to each other, and there is daily movement of people across the border. Although the rabies control on the Namibian side of the border is being implemented and has been successful, it is still endemic in Angola. Since rabies or dog does not respect national or international borders, a cross-border or a regional harmonization of rabies control is important. Last year, the veterinary services of Namibia and Angola conducted a joint technical committee meeting to prepare a cross-border rabies action plan. The meeting developed a concrete action plan for southern Angola with a focus on mass dog vaccination, capacity building and surveillance. The rabies action plan was well received by the Angolan Ministry of Agriculture and Forest. To implement the action plan, the OIE donated 140,000 doses of rabies vaccine under EU support and were officially handed over to the agriculture ministers. There is high policy and administrative support towards cross-border rabies elimination program in southern Angola, and the government have committed to implement the mass dog vaccination campaign. Everything was ready to kickstart mass dog vaccination campaign on 2nd May in southern Angola, and also to start vaccination campaign in Namibia at the same time along the border. The plan was to vaccinate around 200,000 dogs within 2 weeks' time. Unfortunately, the COVID-19 has affected the implementation plan. We hope that the vaccination will be started as soon as the COVID situation is under control. The Angolan veterinary services are looking forward to demonstrate the successful collaboration. On the regional collaboration, the Sub-Saharan Africa is initiating a Pan-African and One Health approach towards rabies elimination program. The Paracon was established in 2014 to provide platform for the member countries to share experience and use the available tools for planning and implementation of the rabies control program. Several multi-stakeholders meetings, workshops, seminars are organized to share experience on rabies control initiatives at the national, regional and continental level in Africa. In Southern African region, the OIE also supported developing rabies implementation plan to the Kingdom of Eswatini and SADC level rabies elimination framework. Finally, I would like to thank you all for listening to my talk, and I am happy to answer your questions. I will provide written answers later if I am not able to clarify your questions now. For your information, this is a pre-recorded presentation and I apologize for not being able to give a clear presentation. I wish you all a successful deliberation and most importantly, successful regional collaboration and implementation of SAARC rabies elimination plan after this webinar. Thank you.
Thank you, Tenzin. Are you online?
Yes.
Yeah, yeah, Tenzin, thank you very much. Just for Asian participant, it is very interesting to know that you talk only about mass dog vaccination. What about dog population management? That is one question. Second question is, it was interesting to know that dog and cats were vaccinated as a part of mass dog vaccination in Namibia. What was the reason behind it, and what is the significance of rabies in cats?
Thank you for the questions. Well, I will just answer about the cat vaccination. Well, the main focus of vaccination in Namibia was on dogs, but if the cats are presented to the vaccination points, the vaccination team usually vaccinate the cats. Like for instance, of around 270,000 dogs and cats vaccinated over the period of 3 years, only about 9% of them were cats. So the focus is mainly on the cat vaccination, only on the dog vaccination. But they have also recorded some instances of rabies cases in cats. So like about 62% of the positivity cases in cats were also reported in Namibia. And among all the samples that has been submitted to the laboratory, about 4% of the samples are from the cats. So in brief, the main focus in most of the African countries as well as in Namibia is on dogs. But if owners present cats, they are vaccinated at the vaccination points. So with regard to the dog population, as I said, like in Africa, about 90%, I was told that about 90%, more than 90% of the dogs are own dogs, not like in Asia where we have a lot of stray dogs. So it means that although they are free roaming in the community, they are available for the vaccinations, and the owners would bring the dogs for vaccination during the vaccination campaign. So that is why they are not like gearing towards like animal birth control like in Asia, since they are mostly own dogs.
Thank you very much. There is an announcement in between. the tripartite group, after webinar, we are distributing certificate of participation, certificate of attendance. For that, we are providing you evaluation form. Those who submit evaluation form, they will get certificate. And second one is, there is suggestion to create WhatsApp group that we'll discuss together, and we'll try to see how we can create network so that we may have exchange of information from expert to participants, as well as from one country to another country. So now we are going for third presentation. This is the main issue of this webinar. We are trying to see SAARC country update on the rabies situation, key progress after SAARC rabies meeting, which was held in Kathmandu last year, and what are the challenges since July 2019. For this, we have Dr. Pasang Tshering. He is Bhutanese national. He's a veterinarian, trained in veterinary epidemiology and economics. He's currently working as a long-term consultant to the OIE regional representation for Asia and the Pacific since May 2018. He worked in the past, he worked for FAO project for SAARC countries in regional support unit RSU based in Kathmandu from 2011 to 2017. Before that, he was working for Department of Livestock under Royal Government of Bhutan, dealing with rabies and transboundary animal diseases. Pasang, the floor is yours.
And some of the progresses made by the countries since June 2019, when we had the SAARC rabies workshop in Kathmandu last year. So my presentation will cover a brief background and introduction to the presentation, and then on the rabies situation, both in human and animal health sectors, some aspects of legislation, national strategic plans for rabies elimination and funding mechanisms existing in the countries, and also touch on the rabies, diagnostic capacities, mass stock vaccination, and post-export prophylaxis in human, One Health or multisectoral coordination mechanisms in the countries in responding to rabies or other zoonoses, and some key challenges and possible solutions to address this by the member countries. As I said, this presentation actually is a collation and analysis of the reports submitted by the member states of the SAARC region. And we have a very good response rate. 6 out of 8 countries have responded. Of course, Maldives, who has not responded, is a country which is free from rabies, but unfortunately we are missing India, which is a very important country in the region. And we have no animal health, human health information from Afghanistan, and also very limited data information from many of the other countries who have reported. So data was collected from, data and information were collected through an online Google form questionnaire survey, and it was delivered through the focal points as nominated by the OIE delegates in the member states. And for the public health, the relevant officials, WHO, SAARC, supported in the participation, and also we contacted through our earlier contacts we have with us. So the collation, analysis, and the presentation of this presentation is done by OIE on behalf of the tripartite and also the member states. We were thinking about each country to make a short presentations, but in the interest of time, we did a combined presentation on behalf of the member states, and also to give a very vivid overall picture across the country, which is possible when we collate and analyze the data together. So this data, basically data information covers mainly the period of 2019 and 2020, primarily 2019 data. So as for the rabies situation in animals in 2019, number of outbreaks, as you can see here, were not available from Afghanistan, Bangladesh, Pakistan, and Sri Lanka. I just put number one. But in fact, that is not the number of outbreaks. It's just that the reported outbreaks. And on the right, you can see the number of species affected, which is not very important, but just to depict the numbers reflected by the countries. And for this, Nepal has actually the data only from the first half of 2019. And what is also important here is all the countries except Pakistan, all the outbreaks, all the cases they detected in the country are lab confirmed. But in Pakistan, it is apparently clinically diagnosed. And also one important thing is in Bangladesh and Sri Lanka, the disease has been detected, rabies has been detected even in the wild animals, fox in Bangladesh, jackal, mongoose, and squirrel in Sri Lanka. And as you can see in the Bhutan on the right side, Bhutan has rabies only in the animal rabies only in the border towns with India. And in human, as you can see, many countries do not have record, or it is not reported in this particular exercise. And Bhutan has no rabies since 2013, except one case in 2016. And for Pakistan, actually, although there's no official record maintained, some studies have indicated that maybe there's around 3,000 cases per year in Pakistan. Then aspects of legislation and regulations on rabies control and eradication. The countries where the rabies is declared as notifiable, both in human and animal health. In animal health, all the 6 countries who reported, they have notifiable, rabies has been notifiable in their, in their respective countries. And 5 countries, except for Afghanistan, I think rabies is notifiable in the human health sector as well. As to the declaration of rabies as a notifiable on the right side table, you can see most of the countries, they have not recorded the year when it was declared notifiable in human health sector, except for Pakistan and Sri Lanka. And we can also notice that even in animal health sector, rabies considered notifiable has been a very recent development, say in Bangladesh, Nepal, and Pakistan. And whereas in Sri Lanka, it's a very, very, rabies has been notified for a very long time. Now, as for the type of legislation list for rabies prevention control or elimination, I don't want to go into the details of the different legislation countries have, but I would like to touch on the existing legislation the countries might have. As you can see here, maybe the one listed by Afghanistan, probably it is a strategy, not a legislation. And you can also notice that for Pakistan, it is just for one province, the Punjab province, and not for the whole of the country. And you can also notice that for Sri Lanka, it is pretty old, 1902 for dog registration ordinance, and Animal Health Act is 1992. So they are in the process of revising the acts. For the human health sector, on the right side, either it's not existing or it is not reported in this questionnaire. Many of the countries do not have legislation related to rabies prevention and control. And for Bhutan, as you can see here, probably this is not also a legislation, but this is basically guidelines and strategic plan, which is also a very recent development. And for Nepal, it is a very pretty old legislation, looks like, in 1964, but revised in 1972. And also Sri Lanka, it is very old legislation, 1894, revised in 1956, and they are in the process of revising it again. Then we covered some areas on whether the countries have national action plans or national strategic plans for rabies control and elimination. And as you can see here in the chart here on the right side, 5 countries of the 6, they have joint strategic plans, and as you can also see here, has both joint and also sector-specific strategy as well, and Afghanistan has only for the animal health component, not for all the sectors. And as you can also notice here, probably Nepal, they are trying to develop a strategy based on the SAAR and PUR exercise we conducted in June last year. And they are yet to finalize that plan and get it endorsed. And also one thing you can notice in terms of the endorsements and approving authority, we wanted to know for sure the strategies which are endorsed and being implemented officially. So as you can notice here, for Bangladesh and for Bangladesh and Pakistan, the Minister of Health of Family Welfare are the endorsing or the approving authority. Whereas for, and again, for Nepal and Sri Lanka, these plans are yet to be endorsed by the competent authority. And we also explored the funding mechanisms or the funding sources for rabies control and elimination in both the sectors. As you can see in this chart, the source of funding for rabies control elimination in animal sector, it is all government sponsored, except for Afghanistan, all are government funded program. And for in the human health, 3 countries fully government funded, and 1 country is both government and external, which is Pakistan. And then we have in Sri Lanka. Then we have Pakistan, who seems to have external funding, and then no information from Afghanistan. And the amount of fund actually available, as you can notice here, we have very significant funding in Bangladesh, both in the animal health sector and also in the human health sector, and also quite significant amount for Nepal in the animal health sector. Then the diagnostic facilities and capabilities for rabies diagnosis in both the countries. All the countries reported that they have diagnostic capacities in the animal health sector. And as you can see, Afghanistan, Bhutan, Sri Lanka, and Nepal have diagnostic facilities both at the national and subnational level. Bangladesh has at the national level, and Pakistan at the subnational level. In human health, then Bangladesh, Pakistan, and Sri Lanka reported they have lab facilities for human rabies diagnosis. And one exception in Bhutan is when required or requested by human health sector, the human rabies diagnostic is done at the animal health lab. And as for the different tests available, diagnostics available in the 2 sectors in the different countries, for Afghanistan, they use DFA and reverse transcriptase RT-PCR and rapid antigen detection test. And in Bangladesh, they use DFA, Bhutan FAT and rapid test, and Sri Lanka, Nepal, DFA and MIT, and in Pakistan, MIT. And in the human health, as I said earlier, Bangladesh and Pakistan seems to have testing facility, and so also Sri Lanka, which sorry, I missed it here, but Sri Lanka also said they have testing facility for human health rabies. Then on the mass dog vaccination program, whether they have done vaccination over the last 1 year, 5 countries out of the 6 reported have said that they have done mass dog vaccination program. And as you can see on the right, I think Sri Lanka and Bangladesh, they seem to have done some massive vaccination, especially in dogs, in these 2 countries. And also you can see that all the 6 countries, they import animal rabies vaccine, but Nepal has capacity to produce their own local vaccine, but which is not sufficient. They also import, and they also use the locally produced vaccines. So doses of vaccine imported or locally produced, you can see in this chart. As you can see, again here, Sri Lanka and Bangladesh have imported some massive doses of rabies vaccine last year. Then we also looked at the post and pre-exposure anti-rabies prophylaxis in human over the last 1 year. And as you can see here, the doses of anti-rabies vaccine for human either imported or locally produced in 2019 is seen here. As you can see, Bangladesh reported producing human anti-rabies vaccine. They produced more than 1 million doses, and Nepal imported more than 300,000 human anti-rabies vaccine in 2019. And as for the post-exposure prophylaxis and immunoglobulin administered in 2019, you can also see that Sri Lanka and Nepal have done a massive post-exposure prophylaxis in the region, and also quite significant immunoglobulin was administered in Sri Lanka. Then we also looked at the One Health or the multisectoral collaboration mechanism. To succeed for rabies elimination, we need to have this multisectoral collaboration, very strong one. Then only we can hope for multisectoral collaboration as, rabies elimination, as some of the speakers earlier stressed on. And the good thing is all the 6 countries have reported they have some form of One Health or multisectoral coordination mechanisms in place in responding to either rabies or other zoonoses as well. But it is mostly in the form of committees and different committees, which I will touch in the next slide. And unfortunately, some may be just ad hoc, and some are interested to just one institute, as is seen in Pakistan, which I'll show you later. And in Bangladesh and Bhutan, actually, they have One Health Secretariat established. Now, this is a very crowded chart, but I'm not going to go into the details. What I want to show you is different types of governance structure the countries have in the respective countries. As I said earlier, it is in the form of different committees, something like in Afghanistan, it is the Zoonotic Disease Committee, whereas in Sri Lanka, it may be a National Steering Committee for IHR. Then in Bangladesh and Bhutan, they have the One Health Secretariat. In Nepal, it's not very functional yet, but they have One Health Steering Committee and a Technical Committee. And they also identified the approving authority or the legal instrument to implement these structures in place. As you can see, in some of the countries, it may be still with the Ministry of Health alone. And then on the funding sources, mostly they are funded by the government. In some areas, they have some small support also from external, like FAO and OIE for Bhutan and WHO for Sri Lanka. And government, Nepal is still just exploring for funding either from the government or from donors. They are yet to establish that mechanism. And for Pakistan, it's a little unique. They don't have a separate funding mechanism, but it is clubbed under the Field Epidemiology and Disease Surveillance Division of the National Institute of Health. Yeah. So then the key challenges, in the countries, as you can see, there are a lot of challenges, but more importantly, which cuts across all the countries. One is, of course, for sure, this lack of funding or budget. And one other was the intersectoral collaboration or the joint activities in the implementation of activities or the resource sharing, whatever. And of course, as mentioned by Dr. Tenzin earlier, one of the key issues is also the stray dog or the unowned dogs or the free roaming dogs in the region, which is a significant problem. And the key challenges and solutions are, again, more from the animal health sector side. I think we haven't covered much from the human health sector aspects. Now, the suggested solutions to address those key challenges I mentioned. Again, here, the pink underlined ones. This is basically the funding issue. We say that there is sufficient fund. And the other, again, it is the joint collaboration or the multisectoral collaboration mechanisms. As for the suggested solution, it is nice to just mention those when there is fund unavailability or insufficiency, we have to make the fund available. But I think we need to go one step further as to find out how to make this funding available, or how to have the multi-sectoral collaboration functional in the country, and how to make it happen, operationalize, may be more important than just listing the challenges here. With this, I think this is my last slide. Thank you very much. I would like to acknowledge very much the focal points who have worked hard on a very short notice to submit your reports to us. I would like to acknowledge your support in that area. Thank you very much. And if there are any questions, it will go directly to the countries, not me.
Yeah, thank you, Pasang. Because of constraint of time, we have to now go for another presentation. Here, I want to highlight, as Pasang has said, there are not much data from human health side. Maybe they are busy with COVID-19. So if data is not available for any country, that means these countries, they did not submit data while we were sending this questionnaire. So that we have to understand. And there are a lot of queries and interaction in chat box, which is very appreciable. And we'll try to answer your question even after this webinar. So till tomorrow, we'll try to see how we can respond to those. So now from global regional perspective, now we are going to country. How Bhutan is using multisectoral coordination mechanism to mount rapid response to outbreaks, cases of rabies in animals. So Dr. Karma Rinzin, he's going to make presentation. Dr. Karma Rinzin is a veterinarian. He's currently working as Chief Veterinary Officer of Animal Health Division under Department of Livestock, Bhutan. He has been working in government service since 1999, and he has been very active in operationalization of One Health, and he has been involved in joint external evaluation under IHR, performance of veterinary services under OIE, and National IHR previous bridging workshop, which was organized in Bhutan 2 years back. He was responsible for implementation of rabies control program supported by WHO in 2006 and 7 in Bhutan, together with Pasang, who was program director at National Center for Animal Health, Serbitang at that time. Dr. Karma Rinzin, he has publication because he did PhD, and the title is Population Dynamics and Health Status of Free Roaming Dogs in Bhutan. So he's deeply involved in rabies business. So now floor is open to Karma for his presentation.
Good afternoon, ladies and gentlemen. Today I'll be talking about Bhutan's multi-sectoral coordination mechanism in responding to rabies outbreak, particularly in animals. Here I'll be briefly talking about the rabies situation in Bhutan. Rabies is a cross-border transmission problem and is endemic in southern parts of the country. There are reports of few rabies cases in interior part of the country, which is mainly an incursion from the south. As you can see from this figure, like rabies outbreaks and cases in animals is decreasing gradually. The last reported human cases in Bhutan was in 2016. After that, we never had any human rabies cases. In a year, like about 7,000 dog bites cases were reported, which is about 1,000 bites per 100,000 population. So, like in Bhutan, we use this One Health approach to rabies prevention control, and the main health, stakeholders involved in this rabies prevention control are animal health and human health authorities. So animal health is mainly involved in carrying out the dog vaccination program, then dog population control, then also responsible dog ownership, while human health authorities are mainly responsible for ensuring the accessibility of the human post-exposure prophylaxis. And then other cross-sectoral stakeholders are involved in carrying out the awareness and education, then assisting in vaccination of dogs and dog population management, then reporting, and then sometimes assisting in rapid response and containment, carrying out the operational research, resource mobilization, and legal framework, and other support. Main activities involved in rabies prevention and control are firstly identifying the risk zones. So based on the risks, we recommend annual vaccination in high-risk zones and vaccination once in every 2 years in the low-risk zones. Then also, we also carry out a lot of advocacy and awareness programs. Both Ministry of Health and then Ministry of Agriculture and Forests are involved in carrying out the advocacy and awareness program. And of course, surveillance in animals as well as in wild animals is also very important. Then, prevention is also a regular activity, which includes promotion of the responsible dog ownership, then carrying out the dog vaccination of both owned and unowned dogs, then also the dog population management program. So these are the activities that's being implemented to prevent incursion of rabies. Then, another important thing is capacity to rapidly detect any suspected cases of rabies. For this, by law, every people who, if they suspect a rabies in any animals, so they are supposed to report. And then, the team from the animal health sector, so we go and then, we try to sort of confirm whether it's a rabies or not. If it is confirmed, then we activate the rapid response team, and then the response measures are implemented, which I'll be talking in detail in the later stage. So before I talk about the rapid response measures, I'll briefly talk about the mass dog vaccination campaign, which we usually carry out on an annual basis, especially in the rabies endemic areas. For the own dogs, usually the owner bring their dogs at the fixed vaccination point, and for the strays, they are usually captured by the trained animal welfare officers. So the vaccination of dogs are being done at the vaccination post. Following vaccination, dogs are usually marked with the vegetable dye, and using this mark, then we carry out this proportion count survey, mainly to estimate the coverage of vaccinations. The decision to move from one place to another is only done when the coverage is more than 70%. And then we also do the cross-border vaccination in collaboration with the counterparts across the border. And while carrying out this mass dog vaccination campaign, we use this mass dog vaccination app, MDV apps, where the detail of dogs are captured on your phone during the vaccination, and at the same time use this phone to carry out the survey, field survey, to estimate the coverage or the proportion count. So here, when you talk about, multisectoral coordination, information sharing is a key thing, and especially information sharing between the animal health and human health activities is very, very important. So from the human health side, they usually, if there's a report of any dog bite cases, or if they come across any suspected rabies cases, so they report to the animal health authorities. Likewise, if the animal health authorities comes across or sees any suspected rabies cases in dogs and other animals, they usually report to their human health counterpart, and also the animal health authorities share the detail of exposed individuals. And then usually the outbreak investigation and awareness is being carried out jointly by animal health and human health authorities. So this shows the framework of multisectoral coordination. So at the national level, we have the Inter-Ministerial Committee for One Health, where the chair of IMCO is either the Secretary of Minister of Health or Minister of Agriculture and Forest on a rotation basis. And then we also have a National One Health Technical Committee. And then the main stakeholders are Minister of Health and Ministry of Agriculture and Forest, where 3 departments are involved, like Department of Livestock, then Bhutan Agriculture and Forest and Regulatory Authority, then Department of Forest and Park Services. Likewise, the team composition of both IMCO and then National One Health Technical Committee are from different sectors like human health and animal health sectors. And then there's also a member from the environment and from the disaster management authority. So as and when there's a report of rabies outbreak, usually we activate the rapid response team, which consists of disease outbreak investigation team, then also the vaccination or the rapid containment team. Then we also have this health team, basically led by the human health authorities, and then quarantine and movement control team, which is led by Bhutan Agriculture and Food Regulatory Authority, and we have a communication team as well as a logistics team who will arrange all the required logistics. So the team composition of the disease outbreak investigation team are from human health authorities as well as from the animal health authorities. So this joint team, they firstly do the investigation and then they try to confirm the disease. Then also this team is responsible to determine the source to rapidly control and prevent spread. Then also advise other rapid response team to implement rapid containment activities. And of course, advocacy and awareness is one main job done by this team. And then we also have this vaccination and rapid containment team with a member from animal health and local government and communities. So here, I think their main roles is case management, then carrying out the mass dog vaccination campaign in and around the outbreak areas, and sometimes in unavoidable circumstances like carrying out preemptive culling of rabid and exposed dogs. And then other activities, advocacy and awareness. Likewise, we have the health team where they are mainly involved in identifying the human exposure cases and access risks. Then they also provide pre and post-bite vaccination, including immunoglobulins, if required. This team also carry out a lot of education and awareness with focus on dog bite management and rabies. And then also we have the quarantine and movement control team led by Bhutan Agriculture and Food Regulatory Authority, where they are involved in monitoring or controlling the movement control of dog, other susceptible animals and livestock products from outbreak areas, and then also like carrying out the advocacy and awareness on rabies. So, till date, like Bhutan has undertaken two rounds of assessment, once in 2017 and once in 2019, using the stepwise approach. And the score in both the assessment was 3.5. And based on this assessment, Bhutan will be able to achieve freedom from dog-mediated human rabies by 2025. However, upon the advice of the Inter-Minister Committee for One Health, we have aligned it with the global target of 2030. Then, we have also developed the National Strategic Plan for Elimination of Rabies, which was prepared again based on the SAARC and Beware assessment. So, based on this SAARC assessment, we have also come up with some priority actions such as strengthening the rabies surveillance in animals, including the wild animals, then to enhance the mass vaccination of dogs in rabies endemic areas, then promote integrated bite case management through One Health approach, then develop and implement national advocacy plan for rabies, then of course to implement the national dog population management strategy. Finally, let me take this opportunity to thank three tripartite organizations, that is WHO, OIE, FAO, for organizing this useful webinar session, as well as for your support in our fight against rabies. I would also like to thank the two ministries, that is Ministry of Agriculture and Forest, Ministry of Health, and other important stakeholders for the support rendered in our fight against rabies. With this, let me thank each and every one of you who are listening to me talk. Thank you very much.
Thank you, Karma, for nice presentation, and it has given us a good impression how Bhutan is working towards One Health mechanism. And one question, Bhutan is promoting integrated bite case management, IBCM. So for many participants, it is a query that what are the challenges when human health and animal health sector have established system in place, like there is a anti-rabies clinic somewhere, and there is a veterinary office in other place. So that is the modality we have for many decades. So how Bhutan is promoting this IBCM? Karma, are you online? Yeah, please. You are muted.
Yes, I'm unmuted. Can you hear me?
Yes, yes, please go on.
Thank you, Dr. Kongkol. Yes, when it comes to IBCM, even Bhutan is fairly new, but one thing what we every time do is, a moment there is a suspected case of rabies being reported, or when somebody comes with dog bite cases to human health hospital, then they intimate the animal health facility, and then they try to do the joint investigation. Similarly, like when there is a when animal health sectors come across any suspected rabies cases, then again we sort of carry out the joint investigation. But honestly speaking, we have just started using this IBCM right now, and then we have identified 2 persons, one from human health, that is Dr. Karma Rinzin, and Dr. Pasang Rinzin from the animal health to take a lead. And then we are here to hear from these 2 guys. Thank you, sir.
So basically it is local champions in both human health and animal health sector who are trying to implement, and that is very, very important. And this is a key, clear message that there should be local champion within the country. And secondly, there is also a query from participants that you have developed national One Health coordination mechanism protocol, and whatever you have developed, is it possible to share through a web page or link? So that is one thing I think that should be possible. Another question is, what is the role of NGO in rabies elimination and One Health operation One Health in Bhutan? So these are the queries I have seen in chat box. So we encourage other colleagues to ask question. Now Karma, please respond. Yeah.
Thank you very much. Actually, I've already responded through the chat box. And then regarding the document, yes, we will check, and then we will provide the link. It's on the website. But our initial first draft was from 2017 to 2022. So recently we updated, which is again will go from 2020 to 2025. So I'm not sure whether the updated version is on the web page, but definitely the older versions on the web page will share that. And then regarding the role of NGOs in rabies and dog population management, the NGOs are mainly involved in advocacy and awareness on the rabies and dog population management. And then they do not play much role more than the awareness for the rabies control, prevention control, but they are quite active in the dog population management, meaning like whenever we do the dog population management program, like animal birth control program, so NGOs help us in catching the dogs and also taking care of, like especially the post-operative cares after the surgery. So that's the main role which NGOs do currently in Bhutan. But right now, like in Bhutan, since increasing dog population is a big problem in the country, so we are doing a big nationwide program to neuter and then also to address the increasing dog population problem. So during that time, it's like the NGOs will definitely be involved. And then we are currently in the process of preparing a memorandum of understanding. And once we sign the MOU, so NGO will be formally involved in the rabies and dog population management program. Thank you, sir.
There is another question, mobile application for mass dog vaccination. So can you elaborate how it is used in Bhutan?
Yes, this is the app actually developed by Humane Society International, since Bhutan did a collaborative project with HSI for a very, very long time. So basically this mobile app, with this app, like moment we come across a dog, we usually capture the dog's detail. Like we take picture of the dog, then like we also paint, and then like once this is captured, so we release the dog from to the place because since this app is linked with the GPS location, that advantage is we exactly know from where we have captured the dogs, so that we release at the same place. And then once that is done, for this proportion count purpose, again we use this app, and then and this app basically help us to designate the particular area where we did the mass dog vaccination campaign. And then we use this app again to estimate the proportion, basically the coverage of the mass dog vaccination campaign, because the dogs that were being sort of brought to the campaign were all marked with the vegetable color pen. Again, I think someone asked about the vegetable color pen. Basically, again, this is a vegetable dye which is available commercially, and then it lasts pretty long. But because usually our campaign, the longest time it lasts is for about a week. So usually it lasts more than a week. So it's quite we found it quite handy, especially to estimate the coverage.
Yeah, thank you very much. We have now 1 hour 45 minutes. So that is even we extended 15 minutes more. So overall, it is very good that after SAARC rabies meeting, there are good progress. Most countries, they went through stepwise approach towards rabies elimination share and PUR exercise. And now many countries, they have developed national action plan or national strategic plan for elimination of dog-mediated human rabies. And this is a good platform, and we could see there are more than 200 plus participants. It seems your commitment for rabies, and that is very, very important. And there are good practices in several countries. Just I want to emphasize that, yes, we are doing treatment post-exposure prophylaxis of cattle, buffalo, sheep and goat and all these kind of animals. This is not the right way. We must strengthen mass dog vaccination so that our food animal, they are not victim of rabies, number one. Number two, there was question about what about animal birth control is sufficient to control rabies? The answer is no. And it should be animal birth control plus rabies vaccination. And thirdly, if we have limited fund, we should spend money on mass dog vaccination rather than animal birth control. So Tenzin, he has already presented, and we have Pan American Health Organization. We had this kind of presentation. So Pan American Health Organization, their rabies elimination program is totally based on mass dog vaccination and active surveillance, not on animal birth control or dog population management, not on providing very quality vaccine for human being. Even they were using sample type vaccine in Brazil. So that is the situation we can understand. So here, the key message is mass dog vaccination. That is the long-lasting and sustainable way to control rabies and eliminate rabies in our countries. Yes, there are a lot of challenges, but we have to find a solution of the problem. And we would like to thank for your active participation. And we'll try to collect those questions, particularly on the clinical aspect, as well as PEP and some other issues, and we'll try to respond to those questions. So tomorrow we'll start at the same time, and our main focus will be developing a national strategic plan, NSP, for elimination of dog-mediated human rabies that serve as a foundation for rabies control and elimination. There will be very good presentations from those who are experts. And we have also presentation from India. That is very, very important, how India is moving towards rabies elimination. It is a big country, and India has important role to play because it is a big country and highest burden of rabies. So if India can do it, then there is no need to ask any other country. It must be possible in other countries because of size and because of these other issues. So we'd like to thank you very much for your active participation, and we'll meet again tomorrow at the time 12:30 New Delhi time and 4 p.m. Tokyo time, and the time is already mentioned here, and we'll welcome you tomorrow. Thank you very much.